Right now, Paul Seegert, Managing Partner at PCS Advisers, joining me. Paul, good morning.
Good morning.
All right, tell everybody why Biden's stuck in a healthcare trap right now.
Well, it's a lot of money. I mean, really, that's what it boils down to.
It always does, doesn't it?
Yeah, you could do the Bernie plan, and we could all just sign a $32 trillion check for who knows how many generations it would take to pay for that. Or we could sign what sounds smaller, but is still a really daunting number and will require legislation and can't be done with reconciliation, which I think is the big hurdle. $800 billion for Biden care to get a public option, and to they have the goal of reducing the age of Medicare eligibility.
You had a recent article by Vice. Paul, and it explores why Democrats' ambitions for health care are shrinking rapidly. And it says the Biden agenda has run into the hardest roadblock in health care, and that is, how do you pay for it? And to what you're talking about, I mean, it's easy to sit there and say we're going to raise taxes on this or that. The payment plan he proposed during his campaign, and that was an increased tax on capital gains, will probably be used to pay for other parts of the Biden agenda. While a $450 billion savings proposal favored by most Democrats in Congress that would allow Medicare to directly negotiate drug prices with pharmaceutical companies was also left out of the family's plan. So what to do next? What's the next step for Biden?
Well, you know that historically, for decades, if you were going to make changes to the healthcare system, it had to pay for itself, or at least in part pay for itself. If we look at the ACA, 80% of the ACA was paid for by cuts and reimbursements in the system and taxes on the system, whether that was manufacturers or health insurers or, just the population at large.
Right.
So there was that. And then the industry went along with it because they saw they would get a lot more customers that were, of course, paid, subsidized and paid for by the government. And they picked up 20 million more customers. So that was, they could see where that would work out to their advantage. The challenge they face, or the Biden administration faces, is when you're coming in and saying it's easy to do expanded subsidies like they did in some of the more recent past legislation, where they expanded for a couple of years. They expanded subsidies on these ACA plans that people can enroll in, but they didn't pay for that with anything. They just borrowed money. So that was fine. The insurance industry and the healthcare industry as a whole wasn't going to fight back against that because they weren't asked for anything, right? Now, the part of this plan is to make those permanent, and then the question becomes, how do you pay for it? And the healthcare industry doesn't have to come out and lobby directly against expanding coverage and look evil in that sense. That all they have to do is lobby against the taxes or the things that the administration will try to do to pay for it. And really, the math just doesn't add up on a lot of this. If you look at what it would cost to reduce the Medicare age, they're talking about 55, but let's say we just took it down to 60. I was doing some quick math, and these aren't exact, but they're not far off. You're looking at $150 billion a month in added expense to add, say, 15 million people. And here's something that's kind of interesting about it. This is not the age group that struggles with being uninsured. Even if you took it down to 62, you'd add 10 million people to the Medicare rolls. Only 670,000 of those are currently uninsured. Most of those are insured. These are people that tend to be at the peak of their career, and they're insured. So it's not a part of the population that's really struggling with being uninsured.
Talking to Paul Seegert right now.
Well.
Yep, Managing Partner, PCS Advisors. Paul, when we talk about healthcare, I get asked the question all the time, why is healthcare in America so much? And there's a number of different reasons. Yeah. First of all, we got an aging population. We also have an unhealthy population. Medicare has grown by 3.5% a year. A lot of administrative waste, new technology. Also, you got a lack of competition with hospitals. A lot of hospitals consolidating. Right. And what people fail to understand is our insurance system is one of the few in this world that is a for-profit insurance system. So all of these contribute to higher prices. But at what point does this all break the system? I mean, it can only go so far. I mean, people now are drowning in debt. How do we fix this?
That's exactly right. This is it's my favorite thing to talk about what you just brought up, because the ACA has not fixed it. Deductibles are up 87%. The average deductible is $5,000 today, while the average family has $400 in savings or less than. That's a recipe for disaster. Premiums are up more than 87%, and insured Americans are holding $85 billion in medical debt. So I would say we're not too far off from that breaking point. And the real problem is a lot of the factors that you pointed to illustrate the fact that we don't really have a free market in healthcare right now. You've got this wall of insurance behind which all the costs are really occurring. We've really taken one of the most powerful forces in the world, the American consumer, and they're consuming in terms of copays and deductibles, but they have no visibility to what they're actually spending on healthcare when they go get a procedure. I was looking at a complex imaging procedure in a major city, I think it was in Dallas, last week in one of the groups that we manage, and you could go in-network and pay the same copay, but depending on the facility you went to, it could be anywhere from $700 to $7,000 for this MRI. And you have no visibility to that as a consumer in the current system, and that's a real problem.
Another real problem, Paul, is the elephant in the room, and that is an unhealthy nation. At what point does this start being put on the shoulders of the American public? And that is, just like people have to, maybe it's their own portfolio as far as investments go. At what point do we maybe start saying, look, you've got to manage your own health portfolio? So if you're unhealthy, if you're overweight, if you're out there vaping and smoking and drinking and leading a lifestyle that is contributing to, pushing these costs up, when is it all of a sudden healthcare going to become somewhat individualized? Or, hey, look, you lead an unhealthy lifestyle, you're going to pay a lot more for your healthcare than the guy that's out there taking care of themselves.
You make a great point, and I think it's probably the biggest miss right now as a country that we're having with this whole COVID conversation. We're not talking about the fact that 78% of people that have been hospitalized and died from COVID were overweight or obese and had these underlying health conditions that are almost exclusively lifestyle health issues, chronic issues that are lifestyle based. Right. And that is pretty unique to our culture. And we're caught in this politically correct environment where you don't want to be, where you have body positivity on one side and then you have health on the other. And we're not doing a very good job in navigating through that. We need to turn this media power on that has misinformed large portions of the population about the actual risks around COVID. When you have 40 to 50% of the population, depending on the news network that they watch, that believes they'll get hospitalized if they get COVID, they think 40 to 50% likelihood they'll get hospitalized if they get COVID, when actually it's a low single-digit percentage chance.
Right.
That shows you the power of the media. We need to turn that power on to educate the population around leading a healthy lifestyle. Well,
that'll never happen because of the woke culture out there, and because that's insensitive, Paul. You can't do that. Yeah. People can't actually take responsibility for their own issues. It's got to be somebody else's fault or somebody else's problem. I mean, that's the world we live in. But you're exactly right. The big conversation around COVID should be unhealthy lifestyles and getting people to start taking care of themselves, but it's not, and it probably never will be.
Mm-hmm. Right. And you look at countries that are far poorer and they don't have the vaccines that we have. All our first world countries, Western Europe and us, we've purchased 4 to 6 times more vaccine than we need. Mm-hmm. Part of that was because we didn't know which ones would work out, and then a lot of them have, and that's a great thing from a public health standpoint. But you have countries that don't have the wealth we have, don't have the vaccine we have, that are also not having the trouble we had. Right. And it's because they actually eat real food, and they walk and stuff like that. They
do things instead of lay around and watch TV and eat Cheetos. Paul, appreciate your time today, man. Thank you.
Thanks for having me.
All right, that's Paul Seegert right there.